Excitement that started 1 month ago today, the first vaccines given in Wisconsin, has faded into questions, concerns, and finger pointing. The state lags behind many others in getting shots in arms, but there isn't one place to lay blame. Naomi Coles looks at hurdles we've crossed and ones that lie ahead.
Just some refills today.
Yep. Pharmacy staff are on the front line serving the sick.
Nope, you're good. A lot of people come in and out throughout the day. They're just on their way home from getting a test at the hospital or something.
But the smaller the store, the harder it gets when an employee tests positive.
Because we don't have the staffing to shift around from other stores.
Josh Lotz, an independent pharmacy owner, just placed a request for 50 COVID-19 vaccine doses.
The drugstore in Jefferson serves hundreds in its community. But 1 month into vaccinations, it still won't be until at least next week before staff here have vaccines of their own.
Disconnected from big health systems,
It is what it is.
rural or independent frontline workers in Phase 1A are only starting to get their doses.
They are not easily identified or grouped in with a hospital that can say, oh, by the way, run down the hall.
A month into the rollout, Governor Evers' administration is facing criticism for such hurdles.
There's no room for delays, and there are no need for excuses.
But across the nation, states are using a patchwork of protocols. Michigan announced Monday it was moving to the next stage, 1B.
By January 11th, all counties may be.
While Minnesota won't move on till February. As early as January 6, Illinois announced who'd be part of its 1B phase,
which will cover everyone in Illinois 65 and over.
While Wisconsin still hasn't decided. We fall on the bottom third nationwide when talking about shots in arms per 100,000. But the real metric, health officials say, is herd immunity.
The ultimate measure of our success is how many people have completed their series and what percentage of the population has been covered with the vaccine to produce herd immunity.
The biggest issue for the state, not enough vaccines from the feds.
We need more vaccine to be allocated to our state.
Looking back, stakeholders identify a few key hurdles.
We were held back by the requirement of not having adequate inventory of the vaccine.
Starting with the federal requirement that held off vaccinations in long-term care. Nursing homes statewide will finish in the next 10 days, but it could be 6 weeks at least before we can say the same about Wisconsin's 4,500 assisted living facilities. They haven't even started.
The question will be, where are we going to be on February 25th?
The head of Wisconsin's Pharmacy Association says allowing communities to move on to a new phase when they're ready could improve the rollout. Illinois, for example, does that.
The data shows that there's a bottleneck for getting vaccine in arms.
Because in rural areas, Phase 1A may go faster than cities.
The dilemma is, do you have them wait then so we can advance as a state to the next phase? Or can we allow communities to flex as they need to?
This is not an insignificant logistics challenge.
Wisconsin Rural Health Cooperative's immunization director points to a broader problem, one lacking funding and infrastructure.
There was no one who had experience handling the vaccine and breaking it down in this state. We've underfunded vaccines in public health in this country for more than 10 years. 20, 30. That means when we come into a pandemic, things are going to be slower than any of us would like.
Vaccine rollout money was included in the latest federal relief bill, but it will be weeks yet before it reaches states. County-level officials, meanwhile, say they're hearing a lot from seniors or those at high risk, wanting to know when it's their turn.
I will not sugarcoat it. They are calling. They are unhappy. They want to know when they're going to get their vaccine and why is somebody else getting it before them.
Going forward, pharmacists stand ready, not just for shots in their own arms.
It's going to be a long road with a lot of work ahead, yes.
But getting off the sidelines when it comes to giving shots to others.
I had to guess community pharmacies will play one of the biggest roles in getting it rolled out to the public, just because they're so much more accessible than going into a physician's office or doctor's office, and there's quite a few pharmacies around.
Reporting for News 3 Now, I'm Naomi Coles.
For more information on the rollout online, visit channel3000.com/vaccines.